Hi, I'm Dr. Rebecca Hunton, founder of RHMD, where we help you become radiantly healthy. We're doing another one of our FAQ videos, frequently asked questions, and today we're talking about men and testosterone and how we do it differently at RHMD. The andropause epidemic you see advertised on television is new. It didn't used to be that way. Men didn't lose their testosterone like they do today as they age. So how did this happen? Well, it turns out one of the most frequently prescribed medications, cholesterol-lowering drugs like statins, actually inhibit a man's ability to produce his testosterone. In addition, it turns out that the man's brain, and I don't mean disrespect, is a little bit more simple when it comes to the hormone feedback loops than the woman. The woman has to carry the baby and mature the egg, so we call it a symphony. For you guys, it's a little bit more simple. And unfortunately, your brain counts estrogen and testosterone as the same hormone. Now, how would a guy get high estrogen levels? Well, biologically, some of us make our estrogen levels. All of us make a little bit with our fat tissue, but some of us, our fat tissue is really efficient. So if a guy has a little bit more excess adipose tissue on board, his estrogens may be high. And then the brain adds that estrogen and testosterone together and lowers the signal from the brain to the testicles, what I call the boys, to make the testosterone. There are other ways of getting more estrogen on board. For example, those plastic water bottles, the BPA that everybody talks about, when they get hot, that chemical that gets in the water is an estrogenic chemical. So if you're eating and drinking a lot of estrogenic foods, then your estrogen levels, your total estrogens will go up and your brain signal to the boys will go down. So in our environment, most of the pesticides and fertilizers that have been invented are estrogenic chemicals. And in addition, and this pertains a lot to guys, hops is the most estrogenic plant on the planet. And hops is what we use to make beer. It's kind of a intuitive thing. Think of your buddies who drink a lot of beer versus your buddy who drinks the scotch and water. The heavy beer drinkers tend to have the boobs in the belly, whereas the alcohol drinkers tend to not. Now, I'm not advocating right now switching from one to the other, but it is something to keep in mind if you come and see us and we measure your testosterone and your estrogens and find that your total estrogens are high. There is an off-label use of a pharmaceutical drug that will block your body's ability to make estrogens. And oftentimes in a guy, using that off-label medication will really lower his estrogen levels, and the boys will start producing more testosterone again. And anytime we can avoid prescribing a controlled, dependency-forming medication like testosterone, we're always in a better place. We also talk about your fertility, and if we want to preserve fertility in a guy, then there are other medications that we can use to prime the pump, to kind of like to say, where we get the signal from the brain going up higher so that the boys will make some more testosterone. And oftentimes after several months of doing that, we can withdraw the stimulus that we've given you to prime the pump, and the guy will continue to make his testosterone on his own. So there's a lot of options out there. It's not just check T, give T, which is what seems to be on the advertisements and in a lot of practitioner offices. And that's how we do testosterone replacement therapy in our men at RHMD differently. And we help them become radiantly healthy the right way. Thank you for entrusting your care to me and my staff at RHMD.